We start with the latest on the coronavirus situation in South Korea. The country is seeing an uptick in cases ahead of an eased restrictions set to kick in from next week. And potentially making matters worse, Korea's notoriously cold winter is steadily closing in. For more on this and other COVID-19 related updates, joining us live in the studio is our reporter Choi Min-jung. Good afternoon, Min-jung.
Good afternoon, Mogan.
Now, we just heard that the figures have jumped today. Can you give us the details?
Right, so South Korea surpassed the 2,000 mark for the first time in 3 weeks. The exact figure stands at 2,111. Officials say the recent spike is mostly due to eased restrictions on social gatherings, which started last Monday, and with more people becoming more complacent in regards to prevention measures. Authorities also revealed that nearly 100% of variant cases last week were the Delta variant. On top of this, South Korea saw almost 20,000 breakthrough infections. This is equal to 0.074% of fully vaccinated people. Most were in their 30s and those who received the Janssen vaccine.
Now, Min-jung, we also hear that South Korean health authorities are on alert as we head over to the winter season.
Right, so there is a growing concern over a potential uptick in the coming days. It's almost November, so we are approaching winter, which health experts say causes the virus to spread much more easily than it can in warmer weather. On top of that, there's the upcoming flu season, so authorities are not letting their guard slip. Let's take a listen.
COVID-19 and influenza are respiratory viral diseases with similar symptoms. When a patient with a fever visits the hospital during the winter, it's more difficult to differentiate the viruses. We ask the public to actively participate by getting vaccinated against influenza as well.
And there's a third factor, Halloween. It's a time when many young people go out to mingle with friends and let down their hair.
Now, given the current situation, it seems like it's all the more important to put up our vaccination rate. How are we doing in that front?
Right, the government will soon announce plans to expand booster shots in the coming hours. They will likely address plans to give booster shots to those who receive the Janssen vaccine. As I touched upon before, the group are the most vulnerable to they're currently the most vulnerable breakthrough infections. They're also expected to talk about whether the Janssen and Moderna vaccines will be added as booster vaccines as well. Right now, only Pfizer's vaccine is being used as a booster shot for medical workers and seniors above 60 who received their last shot more than 6 months ago. The country is also pressing ahead with vaccinating teenagers. For teenagers 16 to 17, more than 62% have reserved shots and 28% have received their first doses. For those between 12 and 15, just under a quarter have made reservations. As of now, the country is not reviewing vaccinations for kids under 12. Authorities have said that it will make a decision after thoroughly examining data and as well as necessity, once approved by the Ministry of Food and Drug Safety.
Okay, so now that's vaccinations covered. Now let's jump into the COVID-19 treatments. What's the latest on that front?
Sure, the government will now soon sign a contract deal to purchase oral COVID-19 treatments enough to cover 400,000 people. This is 10 times more than what was originally planned. The government has been negotiating with overseas pharmaceutical companies with the aim of bringing in the oral treatments early next year. The details will likely be announced on Friday. And currently, Merck is waiting for approval for its oral antiviral treatment molnupiravir from regulators in the U.S. and Europe. The company has also decided to share licensing for the treatment with a UN-backed nonprofit organization to allow more companies to manufacture generic versions. The licensing agreement is expected to expand access in more than 100 countries.
Well, that's good news to hear. Min-jung, thank you for your updates today. We will talk to you again tomorrow in the morning.
Thank you.